Welcome to Project First Line, an introduction to infection control for emergency medical services. In this lesson, we are going to introduce the importance of infection control in the pre-hospital setting and how to identify infection risks. We'll also discuss standard precautions and the special actions and considerations EMS providers can take to protect themselves in the field. We'll wrap up the lesson with a scenario and key takeaways. Let's begin our discussion on infection control, what it is, and what actions you can take to protect yourself. What is infection control? Infection control prevents or stops the spread of infections through a series of actions that are taken when a risk is recognized. We'll explore this concept in more detail throughout this presentation. As we explore the concept of infection control, let's take some time for a discussion question. Why is infection control important in the pre-hospital setting? Take a moment to come up with your answer and then continue when you're ready. Let's talk about the importance of infection control for emergency medical services. According to the National Institute for Occupational Safety and Health, or NIOSH, EMS providers are at higher risk of infection than other frontline emergency personnel. In fact, in 2020, there were an estimated 16,900 injuries and illnesses among EMS providers that were treated in U.S. hospital emergency departments. This number is believed to be higher as exposures tend to be underreported. An estimated 6,000 exposures to blood or respiratory secretions occur each year alone. This is why it's important for us to discuss infection control to prevent exposures. When we think about germs spreading in the pre-hospital setting, it's helpful to remember what makes the field a unique setting with unique challenges and risks of infection. We have to think a little differently about germs and their risks in various situations and environments. Why? Well, in many cases, EMS providers have limited information about patients being treated, especially in situations where the patient's medical history is not available. This lack of information can put providers at risk when dealing with infectious diseases that might not be apparent. Because many patients are ill and weak, they're likely to be more vulnerable to infection, which poses a risk to you as the provider. Additionally, the things that we do as part of giving care put people at risk of infection. If a patient needs an IV, their skin has to be broken. If there are germs on their skin or on the needle, inserting the IV can push germs directly into their body. Procedures such as intubations and IV starts mean working in close proximity to patients, increasing the risk of exposure to infectious pathogens. EMS providers on the front lines have limited information on emerging infectious diseases. This puts EMS personnel at risk as there are uncertainties on how to effectively prevent transmission, as was the experience with the COVID-19 pandemic. And EMS personnel find themselves in various situations and environments where there is an increased risk of community exposure, which is why infection control is so important in the pre-hospital setting. EMS providers are at higher risk of exposure to a variety of pathogens. Exposure to potentially infectious body fluids and airborne particles puts you at risk for various pathogens such as hepatitis B and C, HIV, tuberculosis, influenza, and SARS-CoV-2, the virus that causes COVID-19. This is not an exhaustive list on the screen, but it does show some of the potentially life-threatening diseases that are encountered by EMS providers. It's important to point out that rabies is transmitted by an infected animal most commonly through bites and is also a potentially life-threatening disease to which emergency response personnel may be exposed to. While our conversation today focuses on human-to-human transmission, it's important to consider potential exposure to animals as well when providing care in the field. We know germs are everywhere, including in and on the human body and in the environment. Many of these germs are normal and even keep us healthy. Our bodies are very good at protecting against many germs, but when patients are ill or weak, their defenses may not work as well. Also, some germs can still cause infection in someone who is healthy. In order for germs to make someone sick, 5 things are needed. Let's watch this video, and as we watch, I encourage you to think about your daily work and how the 5 elements described might be relevant to you.
There are 5 things that contribute to a germ spreading and making someone sick. Acting on one or more of them can work to stop a germ in its tracks and prevent infections. First, germs need somewhere to grow. We call these places reservoirs, which are simply places where germs live, a habitat, if you will. Our bodies have many reservoirs for germs. 4 of the most important for infection control are the skin, the gut, the lungs and airway, and the blood. The environment around us has reservoirs too: water and wet surfaces, dry surfaces like countertops, dirt and dust, and devices and equipment. Recognizing where germs live is the first step in understanding how to stop their spread. Because when you know where germs might be, you can stop the risk and take action. For example, cleaning and disinfecting high-touch surfaces, which are reservoirs for germs, kills the germs before they can spread. Second, germs need a pathway. They typically can't travel on their own, at least not very far, so they get from place to place when they are breathed in, by touch, or through splashes and sprays. Many of the things we do in healthcare also create new pathways for germs by breaking down or going around the body's normal defenses. Think back to our IV example. Giving a patient an IV breaks their skin and creates a pathway for germs on their skin or in the needle to get into their body. But disinfecting the patient's skin beforehand and using a sterile needle helps ensure germs don't spread to the patient. Third, germs need a person to infect. That person can be a patient, you or one of your colleagues, or anyone that enters a healthcare facility. Infection control actions like telemedicine, screening, and phone triage work because they simply prevent people from being exposed to germs. The fourth factor of infection: when germs get to that person, they need to get around the body's natural defenses. People with healthy immune systems can often fight back. But for someone vulnerable to infection, like our patients who are already sick and struggling to regain their health, germs are an even bigger threat. And finally, the germ has to survive in the environment while it spreads to be able to make someone sick. Note that these 5 factors don't have to happen in this order for a germ to spread. It's very important to perform infection control actions at any point to help prevent infections.
As presented in the video, here are the 5 elements of how germs spread and cause infection. They are reservoirs, pathways, the person, the body's defenses, and the germ survival. As we explore the basics of infection control, we'll focus on reservoirs and pathways and how easily harmful germs spread to patients and EMS providers. Knowing where germs live and how they spread helps you to recognize risk. Infection control actions at any one of the points we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it's important to think about where the germs are, which reservoir or reservoirs you are dealing with, and how the germs might get somewhere else, the pathway. Then, you can recognize the risk for germ spread to happen and do something about it. As we see in this example, the reservoir is blood from the injured patient. We know the blood poses an infection risk if touched, which is the pathway, so we make sure to put on gloves to protect ourselves from exposure. By recognizing the infection risk, we can take the necessary infection control actions. In healthcare, we think about germ reservoirs in the human body and in the healthcare environment. Reservoirs in the human body are the skin, the gastrointestinal system, the respiratory system, and blood. Reservoirs in the healthcare environment include water and wet surfaces, dry surfaces, dirt and dust, and devices. There are a few common pathways for germs to spread from reservoirs in healthcare: by touch, when they're breathed in, through splashes and sprays to the eyes, nose, or mouth, or to broken or unhealthy skin, and through things we do as part of healthcare that bypass or break down the body's natural defenses. For instance, procedures that require breaking a patient's skin can allow germs from the patient's skin to get into their body. Anything that we do that involves touch, whether it's touching a person or things in the environment, like blood pressure cuffs or a pulse oximeter, can be a risk for germs to spread. How can we control the spread of germs? Infection control practices, like standard precautions, can be used to prevent and control the spread of germs. What are standard precautions? Standard precautions are based on a risk assessment and make use of common sense practices and personal protective equipment. These basic practices apply to all patient care, regardless of the patient's suspected or known infectious status, and are in place to protect healthcare providers from infection and to prevent the spread of infection from patient to patient. Standard precautions are a first line of defense to keep germs from spreading. However, effectiveness of these practices depends on how well steps are consistently followed. As frontline healthcare providers, you should use standard precautions to care for all patients in all settings where care is delivered. Standard precaution practices assumes any patient's blood or body fluid may be infectious. The following infection control actions that could decrease or eliminate the risk of germ spread fall into the category of standard precautions. These include hand hygiene, environmental cleaning and disinfection, injection and medication safety, appropriate personal protective equipment or PPE selection based on activities being performed, respiratory hygiene and cough etiquette principles, and properly handling, cleaning, and disinfecting patient care equipment and medical devices. Hand hygiene. Hand hygiene means cleaning your hands by using either hand washing with soap and water, or antiseptic hand wash, antiseptic hand rub, which includes an alcohol-based hand sanitizer, or surgical hand antisepsis. Soap and water carry germ particles off of the skin, while alcohol-based sanitizer inactivates germ particles. Healthcare workers touch a lot of things during our workday, so being diligent about hand hygiene is really important. But even though we all know how important it is to clean our hands to keep germs from spreading, studies show that on average, healthcare providers clean their hands less than half of the times they should. We might need to clean our hands as many as 100 times per 12-hour shift, depending on the number of patients and intensity of care. It is recommended that you clean your hands with soap and water for at least 15 seconds. Use your preferred water temperature, cold or warm, when washing. Warm and cold water remove the same number of germs from hands as the water itself does not usually kill the germs. Cleaning and disinfection. Cleaning and disinfection includes the environment, patient care equipment, and reusable shared medical devices. Cleaning is a process that removes things like dust, dirt, grime, and other spills, smears, and everyday messes from surfaces, along with some germs. Disinfection is a process that kills germs. It's important to keep the healthcare environment clean to stop these germs from spreading. Remember, use an EPA-registered disinfecting product to destroy germs. By following the instructions on the disinfectant label, especially instructions for contact time, we are ensuring items are disinfected to keep germs from spreading. We'll take a quick look at how to read a product label. Here are the 5 things that we want to look for on a disinfectant label. First, we want to make sure that the disinfectant is an EPA registered product, as this ensures it meets regulation standards. Next, we make sure that the product can be used on the surface that you intend to disinfect. Using a disinfectant on a surface that the product is not intended for can damage a surface or item, which poses a risk to human and environmental health. Then, we want to make sure that we know if the disinfectant is effective at killing the germs we are wanting to eliminate. Also, some products may require dilution before application. If there are dilution instructions on the label, make sure they are followed to ensure that the product is effectively applied. The last and very important piece of information to look out for is the contact time, which is also called dwell time. The contact time means the amount of time a disinfectant needs to stay wet on a surface to work properly. When you use a disinfectant to clean a surface, it needs a little while to effectively kill the germs. As an example, if you are using a product that notes a contact time of 5 minutes, then the surface that the disinfectant has been applied to must remain wet for those 5 minutes in order for it to work. If you wipe away the solution too soon, or if you fan or blow on it to make it dry faster, the product will not work well enough to get rid of the germs. It's important to follow the product's instructions and recommended contact time to make sure things are thoroughly disinfected. Injection and medication safety. The One and Only campaign is a public health effort to eliminate unsafe medical injections. A good rule to remember is one needle, one syringe, only one time. This same rule should also be applied to insulin pens. One insulin pen, only one person. Best practices include follow proper infection control practices and maintain aseptic technique when preparing and administering medications. Never administer injectable medications from the same syringe to multiple patients. And medications labeled for single use or single dose should never be used for more than one patient. Every year, unsafe injection practices by U.S. healthcare providers, like syringe reuse and misuse of medications vials, cause outbreaks. Since 2001, discovery of unsafe injection practices have prompted nearly 200,000 patients to seek testing for bloodborne pathogens. PPE used in healthcare includes gloves to protect the hands, gowns and aprons to protect skin and clothing, face masks to protect mucous membranes of the mouth and nose, respirators to prevent inhalation of infectious material, goggles to protect the eyes, and face shields to protect mucous membranes of the face, mouth, nose, and eyes. We'll go into more detail, including appropriate donning and doffing of PPE, in a separate session. Respiratory hygiene and cough etiquette. Respiratory viruses can be in the nose, mouth, airway, and lungs. Talking, sneezing, and coughing can spread these germs into the air. Masks block these germs. When not wearing a mask, cover your mouth and nose when coughing or sneezing with a tissue. If you do not have a tissue, use your elbow, not your hands, because hands can spread germs. Dispose of the tissue, then clean your hands with sanitizer or soap and water. When used correctly, respirators filter germs, both very large to very small, as air is breathed in and out. Infection control actions, such as source control and wearing masks and respirators in healthcare settings, protects you, your patients, and your coworkers. Let's look at the differences between source control and respiratory protection. When we talk about source control, we refer to the protection of others through the use of masks, such as surgical masks, that cover a person's mouth and nose to prevent the spread of respiratory secretions. These masks help reduce the spread of large respiratory droplets to others when the wearer talks, sneezes, or coughs. Fit testing is not required for this type of protection. We also have what's called respiratory protection. The purpose of respiratory protection is to protect the wearer. This level of protection is achieved by wearing respirators, such as an N95 respirator, capable of filtering small respiratory droplets. Respirators are evaluated by the National Institute for Occupational Safety and Health for their effectiveness to protect the wearer from respiratory hazards. It's important to note that a wearer must undergo fit testing to ensure adequate level of protection from the respirator. In summary, the goal of standard precautions are to protect healthcare workers. We can ensure the safety and well-being of healthcare personnel by minimizing the risk of exposure to germs. Standard precautions are also designed to protect patients. We can guard vulnerable patients from acquiring infections during encounters. Standard precautions help to prevent transmission. We stop the spread of germs between healthcare personnel, patients, and the environment by implementing standard precautions. And standard precautions help to maintain a safe environment by reducing the number of microorganisms in the surrounding environment. How do we put standard precautions into practice? Here are the 4 steps that can be taken to protect yourself from infectious diseases while in the field. First, assess the scene for infection risks. This means identifying reservoirs and pathways that may pose a risk to you. Then, adjust infection control precautions as necessary. For example, your patient shows respiratory symptoms and you discover that they recently traveled, which should prompt you to then apply the appropriate protective equipment. Next, perform hand hygiene before and after patient care. And clean and disinfect patient care equipment and medical devices to remove harmful germs that pose a risk to you, your colleagues, and patients. When taking infection control actions, there are some special considerations to think about. Those considerations include remain alert for any information related to travel history and signs and symptoms of communicable disease, such as a fever, cough, GI symptoms, or an unusual rash. Implement standard precautions based on the patient's clinical information. And, when possible, avoid direct contact with a patient who may have a communicable disease until appropriate PPE can be applied. Now that we've talked about how germs spread and cause infection, let's put that knowledge into practice. In the following scenarios, think through the elements of how germs can spread and cause infection. For this example scenario, our germ is MRSA. Our reservoir is the dry surface of the cot mattress and rails. The pathway of the germ spreading from the surface to the provider is through touch. For this scenario, let's recall the 5 elements of how germs spread and cause infection. Those 5 elements are reservoirs, pathways, a person, a body's defenses, and survival. Let's expand the scenario further. In this example, the improperly cleaned cot is the reservoir contaminated with MRSA. We know that the pathway is touch, as MRSA can be spread by contact. But how could it get to the EMS provider or to a patient? Well, they could simply pick up the germ on their hand when they touch the cot if it has not been cleaned and disinfected. If the EMS provider fails to wear the appropriate PPE, such as gloves, and fails to practice proper hand hygiene after handling the equipment, MRSA can then inadvertently transfer from their hands to their face, nose, or mouth. The outlined 5 elements in this example isn't the only way germ spread could happen. There are many ways that the elements could work in this scenario for an end result of personnel or a patient becoming infected. It's also important to remember that the elements aren't steps in an order and that it's not inevitable that someone will get sick from a germ. Infection control actions can keep germs from spreading at any point. Let's look at our key takeaways. Understanding where germs live and how they spread helps you to take action to prevent infections. Standard precautions are infection control actions used to reduce the spread of germs and are used with any patient, regardless of known or suspected infectious status. And EMS providers should assess the scene for infection risks and adjust standard precautions as necessary. You can keep exploring these topics on your own using the resources found on this slide. Project Firstline has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project Firstline on social media. Thank you.